What we're finding as we go up that EMR adoption model, clinicians are expecting more availability. They're expecting more performance. They're expecting the system to be stable, up and running. It's no different than you and I expecting the utility power company to be on. When I turn on the water, when I turn on my TV, when I turn the internet on, all those things are pretty instant, second response. That's what we're finding. And in fact, our clinicians are saying, don't give me one more new function if that isn't available. If you can't give me that performance and do that. And that's why it's very important that we put in IT service management tools like CompuAdvantage so that I can get an end-to-end perspective of how are my systems performing down to an end-user experience. So we're running remote robot agents out on our networks to simulate, 5 to 10 to 20 functions that a clinician does. And they continue to do it even if they're not doing it. It gives me feedback as to what is happening with that clinician before they pick up the help desk call. So we have an SLA per se assigned to that function, and when it falls out of that range, we get a page. So I'm 2 steps ahead of the clinician versus being behind. I'm proactive, monitoring and proactive fixing things if they come up versus waiting for that call to come in. And I think that's a tremendous thing, because then our clinicians are feeling like we're doing our job in IT. We're supporting them, and we're using technology just like they are, but for our means to provide the service that they need.
We adopt because of function and feature, but we continue using it because the system actually performs to those functions and features. And organizations like the DMC, is they've adopted higher levels of EMR because of function and feature, but they keep that going and they're successful at it because of performance and availability.
Can you give me a little background about your facility? So I'm like a bed size or,
Sure, 2,000 beds. We're the largest employer in southeastern Michigan. We have about 30,000 employees. We have 8 hospitals. It's an academic medical center in conjunction with Wayne State University and Michigan State University. So we put out 1,000 residents. Overall, 2,000 people are being trained at one time within our hospitals. Pretty well known, a lot of different specialties from that standpoint. So
I'm interested in the proactive management piece, because it does seem a very good way to manage.
It's if I was to give advice to another CIO, I'd say watch that. When we started, we brought up our first hospital back in 2006 on the higher level of EMR that I spoke about. We had failed previously because of that main point. The old model was, more of a disaster recovery, more DR focus that said the system is down. Clinicians have raised that standard to say when the screen flips are slow, when orders are not refreshing on time, when I can't bring a patient list up within seconds, that's slow. That to them is down. And if there's enough of those or enough critical functions, they will declare a downtime, even though technically in the old world, we'd say the database is up, the servers are up, system isn't down. But they've gone to a new level of pointing to those individual functions to say, if these functions are not working, I'm going to declare a downtime of the system until you get that fixed, because it slowed me down providing patient care. And they could go back to paper. So I'm being forced into a higher level of uptime to support an EMR that has no paper. So when you think about it, the more you go towards electronic, the higher level of standard that's being set for CIOs and for IT departments to meet. And that's why we have to have our own technology and our own tools to meet that demand.
So your relationship with CompuWare was basically on the services that support the EMR?
Yes. Yes. We monitor over 600 servers and have 15 plus remote agents that are out there, but the main usage of it was for our EMR. Because we saw so much value with that, we've now, every time I bring in a new server, I buy that and purchase that and begin running that on our other servers. That way it becomes just, that service management model becomes ingrained within the IT department because it works so well.
It's about the clinical process that we ought to be paying attention to, not just about the technologies that are there. And I think that's what the DMC is representing well, being able to say, we're in the clinical business. So let's monitor that clinical process and make sure everything is working for the clinician as expected.
Yeah. We're on a journey. EMR is not something, as we found out very clearly as we launched our last hospital, that after you launch it, you're done.
Yeah.
It is the second that you launch it comes a new request for a change, a new document, something else to add to it. And the reason why that's great is because your clinicians have actually seen it work, are getting the performance, so now they're feeling more comfortable that it's going to do what they've asked for, but they're thinking of new ideas with technology of how to improve it. That's when you really know that you've come to a good point, when your clinicians are giving you feedback to say, here's the way you could change that. Now, that means there's going to be a lot of changes flowing into us that we have to keep up with, but it also means that they've accepted it, they're adopting it, they're using it in their practice. What we found is, I've asked a few times, well, what would you say if I was to take this away from you and you were to go back to paper? And they'd say, absolutely not.
Yeah.
We have new nurses that come in from the medical school after they graduated. And we've had experiences where we've had to have a downtime because of installing a new release.
Yeah.
And they've actually said when their leadership have come to them and say, we're going to go to a downtime, which will mean you'll have to use your paper forms. They say, what do you mean? How do you do that? It's kind of funny, but they've gotten so used to the system now that they do expect it.
Yeah.
And again, that's why it's so critical to have the system up and performing properly.